ready to microblade, which is fine strokes with pigment. It's semi-permanent, and it gives life to a brow when there is little to no brow, and it actually looks like a brow itself. So we're preparing the patient for microblading. So I've cleaned the area, I've numbed the area, and now I'm prepping to measure. So what we've done is we have numbed our patient, and now we have measured our patient and shown the patient the outline of the brow and where I'm going, and she has agreed to the shape and what's going on here. We have talked about the shape itself and the color and how the brow is not going to pass the perimeter. It's hard to determine what the brow is really going to look like if you drew it out in the black kohl pencil in the measurements, because then it's going to look like a big fat Groucho Marx brow. But if they can at least see the perimeter, then they can understand how the brow is going to look, and they will approve it before I start the treatment. So what we're now going to do is we're going to start with our strokes. This actually does take a little bit of time because you really want to see where you've been so you don't go over the strokes and do too much. You're actually going to hear the blade on the skin, but it's just doing a little micro scrape. She actually, how do you feel, Jean?
I'm okay. I'm sorry. I feel nothing.
So what we're doing now are we're doing little micro blades into the skin with the pigment, and you will hear a little scraping with this, but it generally doesn't feel too uncomfortable for the patient. How are you feeling, Jean?
I do not feel a thing.
The sound is a little worse than it feels.
Mm-hmm.
So the procedure, the first treatment is about 2 hours so we can get the most accurate measurement and the most accurate first application. Touch-up is about 4 to 6 weeks after, and the touch-up really is if some of it fades, if the patient wants a little darker color, we can just kind of do touch-up then, and that's usually just about an hour. Really the main time stealer is the numbing, because it takes about 30 minutes to numb. So other than that, the patient's happy. The color will change, the way the brows look will change, it might fade in and out. So between day 1 and probably day 25 to 30, the brow's going to look a little different at times. In the very beginning, we don't want you to sit in hot tubs or go in a lake, or just really protect the area because it is a slight abrasion, so we want to make sure that no infection occurs. It's very, very simple. We just ask you keep it covered for about 5 days, and we give you an ointment for that. And then the patient's happy.